My name's Heather Pinches. I'm Head of Clinical Trials at NHS Digital, and we're going to talk to you a little bit about our work in DigiTrials. We set out on our hub journey with a bold vision. We were very keen to develop a range of data services that were tailored to support clinical trials. We very much were disease agnostic. We're focusing on making the best use of the data that we hold in NHS Digital, and that's England-wide linked data sets drawn from a number of healthcare settings. And we're also very keen on delivering benefits with and for patients, the NHS, for trialists, and for UK PLC in general. And I say that I've chosen my words very carefully there. Very much with and for was something that we wanted to very much build into the way that we worked as a hub. We've always had ambitions to develop a range of services across the whole life cycle of clinical trials, across the sort of find, recruit, follow-up, or feasibility, recruitment, communication, outcomes, which is the specific services that we've been developing. And those were very deliberately aligned to where we felt that the national England-wide linked data that we hold could be used to help solve some of the challenges facing running clinical trials in the UK. In particular, things like the increasing cost of running trials, the focus of those trials in specific geographical locations, and also the fact that the people who were participating in those trials didn't always represent the whole population of the UK. So those were some of the really key challenges we were setting ourselves to help to solve. And I think we have, and we'll talk a little bit more about some of our success in those areas. So like many, the journey's not been entirely straightforward. So we started out to deliver one service only, get that up and running, do it really well, and then build out from there. Clearly, COVID threw a massive hand grenade into that, as many others have talked about today. So very much we pivoted quite early on to support providing outcomes data, to support trials that are focusing on COVID-19. In particular, we worked with the recovery trial, maximising the use of routine data to prove trial outcomes that then meant that the burden on frontline staff to collect that data was really minimised, and therefore that trial could get up and running quickly and could report results quickly as well. Gradually, as the pandemic progressed, we did also pivot back round to recruitment and communications and worked very specifically with a number of trials, using some of the freedoms under COVID that were allowed, so the COPE notice, for example, to support recruitment. In particular, we worked with the principal trial to support their recruitment, testing primary care medicines, and also we've worked with some of the more recent antiviral trials, again, supporting the recruitment process. And through that, we were able to learn an awful lot that has then translated into our ongoing journey of development, where we've been very much building out our service offer across those four areas on the slide. And I suppose the pandemic did provide us with an opportunity in some ways to prove the value of the service that we could provide and prove the value of using that England national data, using routine data differently and better to support clinical trials. And I think that has also been really instrumental in us securing some additional investment from Department of Health and from NHSX and other colleagues to help us to build those services. And we learnt an awful lot to continue our journey. So where are we now? So we find ourselves very close to kind of having a full range of offers across those four service areas. So we've built out the feasibility service that we started out right at the beginning as a hub. So we have a supported service, and we're working increasingly closely with our SMEs that know the data assets and our analysts to provide that supported service to run really detailed feasibility queries. We're also adding to our service offering with a self-service dashboard, which is currently in private beta testing. So if there's anybody out there who is interested in helping us to test that new service, then we'd really like to hear from you. So do come and speak to us. We've started that self-service dashboard building on the National Register of Patients in England and also using hospital data. But we've already started modelling the next iteration of that, which is modelling primary care medicines data into that as well. So we're planning to launch our service in the autumn as a public beta, and again, looking to then iteratively improve that over time. The recruitment service is in pilot testing, so we're working with 4 pilots at the moment. 1 is just coming to an end, 1 is complete, and then 2 are just about to start. And through that, we've been testing what is the sort of sweet spot for that direct-to-patient invitation, because that's the model, the recruitment model that we've been developing, working really closely with colleagues at the HRA and the Confidentiality Advisory Group to use the legal gateway, Section 251, to allow us to write directly to patients. And we've very much been doing that with a lot of kind of patient and public involvement, as you would expect, to understand how does that work best, what do patients feel about that direct approach, what sort of, we've been doing some behavioural insight testing, looking at how do we frame the invitation letter so that we are encouraging people to sign up to join clinical trials. So the next service, communication, we have our sort of MVP service in place, so our minimum viable product is out there. We're currently in the process of doing some end-to-end testing of that service with a couple of customers with a view to, I guess, a more high-profile launch in September this year. And very much some of our focus on the communication service is how can we free up the time and resources of our frontline researchers by doing some of the administrative work in the background and making it easier to kind of find patients if they've moved and directly sending out those communications to patients. And again, we're doing some work with an academic partner to sort of work out what is the sort of value of that to local healthcare systems in terms of what that frees up in terms of frontline resource. And then finally, our outcome service is an existing service that we've had very much building on the data access service we've had at NHS Digital for a number of years, but very much focusing on scaling up the service, introducing automation where we can, building the team that will work with trialists to take their application through our kind of data governance process. Very much focusing on trying to make that process as fast and efficient as possible, but maintaining the appropriate governance. And I think that comes back to the issue of trust that we've been talking about and debating quite a lot today, and we will continue to debate as a system over time. We need to get that right. And allied to that is transparency. And one of the key things that we've also been doing is trying to be a bit more transparent and engaging patients much more in how we're using their data to deliver the services that we're delivering. So I'm going to hand over now to my colleague Andy, who's going to talk a little bit more about some of the practicalities of what we've done.
Well, there's an awful lot of you out there, and some of you look a bit scary, but there is one positive, and that I won't start off on mute. So if we move on to the next slide, we just want to talk a little bit about sort of some of the success that we've had. So we'll use the NH Gallery trial, I should say, and talk about that. So this is a trial to test a new blood cancer test. It can detect up to 50 cancers. It's got massive potential in this country to help us diagnose people earlier with cancer and save lives. But it's got a number of different challenges in terms of getting itself moving and off the ground, and we were able to help with that. So let's just have a look at some of the things it was trying to do. So it had some challenges on size and speed. It was wanting to recruit 140,000 people within 10 months. That's an awful lot of people given the traditional methods. It had a lead time where it wanted to get up and running within 6 months. It was really, really imperative that we got this moving, especially with what we've seen about cancer diagnosis. We've also had to try to find a healthy cohort. So how could DigiTrials help? Well, we could provide access to routine data that NHS Digital curates. We could work in partnership with Grail, who are running this, looking to provide a service wrapper, getting project management in there, getting SMEs in there about the data. We could support them with their Section 251 application, going to the actual confidential advisory group with them and sort of supporting that application. We developed a bespoke pipeline that was flexible, that allowed them to turn the tap on and turn it a little bit off, depending upon the success rates that they were getting. Very important when you're talking about this size of trial. We took away the third-party management. So one of the great things about our recruitment services, no sort of patient data leaves the NHS. So we manage those invites that go out on behalf of the trials, and again take that away so that they can concentrate on their expertise, that running of the trial. To date, we've sent 1.4 million invites out. The trial is on track to recruit those 140,000 participants next month. It's now become known as the fastest recruiting large trial. And again, we've seen a massive conversion rate, so sort of from the DigiTrials recruitment method of around about 10%, which is something to be celebrated. So I'll quickly go on to our last slide. A number of people have talked about this, but this is our version. So our core development panel have been with us right from the start. They've helped shape our services, made sure that we've put the patient right at the heart of everything that we do. Traditionally in the NHS, with the research environment, we've looked to trialists, but patients need to come along with us. If they don't, our services can't sort of succeed. And one big thing is they help us to talk in plain English. And we've got the lovely Georgina from our panel here today, and she will be marking our presentation skills. So there you go, that's one for later. But we're also using a user-centered design approach. So very much we've got a customer user group. Some people here today are part of that. But we tend to spend a lot of time talking to trials after we've done the work, trying to learn the lessons. What can we do better? What worked well? What opportunities there are? So I was going to finish this by doing some crowd surfing, but Kay has banned me. So what I will say is do come and talk to us at the market stall. I don't think we've got any freebies other like the other hubs, I'm afraid, NHS budgets and all that, but we'd love to talk to you and sort of see if we can explore some opportunities. So thank you very much, everybody.